All set? Okay. Everybody all set? Okay, welcome everybody and welcome to our weekly media briefing. On behalf of the City Council, School Committee, City Manager Augustus, Superintendent Maureen Benenda, my partner here, Dr. Hirsch, I just want to wish everybody a Merry Christmas and a Happy Holiday. The City Manager continues to recover and work from home, stay in close contact with his staff. And as he mentioned, he's going through the COVID-19. It's not a joke, and I wish him well in a speedy recovery. And please follow his lead and stay at home if you can, if you're not feeling well. Again, please wear your mask when you're out. Practice social distancing and good hygiene, especially as we go through, as Dr. Hirsch has mentioned, expecting another surge after Christmas over the holidays. And I think I saw on the news that 81 million people are traveling this week, so all those 81 million people will be coming home. So I think we're expecting a surge, and that's why I'm asking people, if they can, stay home, stay in your realm, in your house, and with the members of your family that you ordinarily stay with. Winter sports has been canceled here in the Worcester Public Schools, acting on the best advice from the Public Health Department in consultation with myself and the superintendent and school committee. Decided to cancel winter sports. I know this is a very difficult decision. I know how many young athletes, parents, and coaches are working forward to this season, but in the light of the continued increases in our numbers, this is simply not a risk we're willing to take. You gotta remember, one child comes down with COVID-19, brings it home to their parents or other siblings who might be sick, or might have other health issues, or their grandparents. And as of December 23rd, there was over 1,700 cumulative COVID-19 cases in school-aged children in the city of Worcester. And that was enough cases to fill like an entire high school here in the city. I'll give you the update on the numbers. To date, there have been 13,762 confirmed positive cases in the city of Worcester. That is an increase of 977 over last week's report from December 18th. So last week we had an extra day in there, and this week we have 1 day short, because I think we gave the press conference on Friday last week. So the numbers are averaging about the same. The towns, Shrewsbury has 1,381 cases. That's an increase of 127. Holden has 653. That's an increase of 75. Grafton has 532. That's an increase of 49. Leicester has 535. That's an increase of 39. Combined St. V's and UMass data, total COVID positive patients right now is 247. That's an increase of 9. Total COVID positive ICU patients, that's 64. That's an increase of 8. Total COVID-19 deaths to date, 446. That's an increase of 18. Total COVID plus employees to date at the hospitals is 1,184. That's an increase of 100. Worcester deaths, 322. That's +1 over last week for Worcester residents only. DCU Center update, there are 30 positive patients currently at the DCU Field Hospital. 60% of those patients have been from UMass, the rest are from Boston Medical Center. Cases by age, 19 and under, 1,755. This is for City of Worcester, that's 13%. 20 to 29, that's 2,404, that makes up 18%. 30 to 39, 2,270, that's 70%. 40 to 40, ages 40 to 49, that's 1,988, that represents 15%. 50 to 59, that's 2,013, that represents 15%. 60 to 69 is 1,397, that represents 10%. And 70 and up is 1,664, that represents 12%. The numbers tell us under cases under age 40 years old continue to account for a big percentage of our total cases. It's over 45% of past week's cases. I'll just give you some more information. UMass testing on Monday, and there's going to be UMass testing on Monday and Tuesday of next week here at the Mercantile Center. If people are interested, I believe they're from 10:30 to 3. Let's see. And action steps. This is some of the things that City of Worcester have done. We have been dealing with a post-Thanksgiving spike in COVID-19 positive cases for several weeks. In the week leading up to Thanksgiving, the city's 7-day average case count was just above 92 per day. 3 weeks later, the average has almost doubled to almost 181 cases per day. The city manager announced this week that effective today, all municipal buildings will be closed to the public until January 11th. All non-essential employees will work remotely, with essential employees working in person when necessary. We're doing this because of a precautionary measure as we continue to deal with the increase in the positive COVID-19 cases. I want to ensure the residents of Worcester that the work of government continues and services will not be interrupted. Everyone has to do their part, and the city government should lead by an example in doing its part to stop the spread. And you can find more information on our website at www.worcesterma.gov. Regarding vaccines, early last week, the Mass Department of Public Health asked local health departments across the Commonwealth about their capacity to provide COVID-19 vaccinations to first responders, including police, fire, and EMS. The Worcester Division of Public Health, along with the Worcester Emergency Management, have been collaborating for some time on planning for the vaccine distribution and through appropriate emergency dispensing sites. At this time, the Emergency Distribution System Advisory Group is reviewing possible locations that would be suitable to accommodate various stations, including screening, registration, vaccination, and recovery. The group has also had conversations with police and fire chiefs to garner maximum participation. And the Worcester Emergency Management Systems will be vaccinated by UMass. The city has submitted their preliminary emergency distribution site vaccination plan to the Mass Department of Public Health, who will ultimately approve our ability to vaccinate our first responders. Should the plan be approved, the Worcester Department of Public Health anticipates taking delivery of the vaccine, likely Moderna, in early January. A booster will be administered 30 days later. Governor's, some of the actions he took this week to stop the spread. His temporary executive order goes into effect Saturday, December 26th. It runs through Sunday, January 10th, although it will be extended depending on what data shows at that particular time. There are a number of changes, most notably a reduction in the capacity levels in several sectors from 40 to 25%. This includes restaurants, which with the limit set at 25% of pre-COVID capacity. In addition, capacity at indoor venues is reduced to 10 people, while outdoor capacity is reduced to 25, and also on private residences remain the same, 10 indoors and 25 people outdoors. And more information can be found at the state website, www.mass.gov. And I know these restrictions have an impact on our lives, including our small businesses here in the community. Our restaurants have been particularly hit hard. I want to recognize all the cooperation by most of them and a large chunk of our local businesses in following the COVID-19 protocols and guidelines. Our inspection teams will continue to go out and conduct spot checks. And the ultimate goal is to have compliance through education, but when necessary, we will issue fines and report any offenders to the ABCC. Because we are getting a number of pictures that's sent to us here in City Hall by patrons who we have pictures of restaurants or other businesses where capacity is over 25 and no masks, is my understanding. And so we are taking this seriously, and we're going to be taking this seriously right away. So we are going to step up enforcement for those who do not comply, and particularly the repeat offenders. And a lot of people have been warned, and if you're going to be a repeat offender, you can expect a visit by inspectional services. And our goal is to keep businesses open and emphasize education, but at the end of the day, as I said, the ultimate goal is compliance. How we achieve this will depend on the willingness of folks to follow the guidelines and protocols. And most of our businesses are following the protocols as we do these inspections. Small business relief. I know Santa hasn't come yet, but our small business community got an early present in the governor's announcement this week of $668 million small business relief package. Restaurants, retailers, and other small businesses across the state will benefit from this, including many in Worcester. It could not come at a more opportune time with so many small businesses desperate for some type of financial relief. This comes on the heels of the governor's previous announcement of $49 million in state grants for more than 1,000 small businesses, including several here in the city of Worcester. With so much financial uncertainty caused by this pandemic, this funding is much needed and much appreciated. So I want to thank the governor and his team for putting this together. And if people want to find out if they're eligible or not, you can go to www.empoweringsmallbusiness.org. That's www.empoweringsmallbusiness.org. Or you can call our Economic Development Department. If you have any questions, they can provide technical services to people and businesses here. They're at 508-799-1400. Now, regarding the holiday gatherings and restrictions placed on them, I know these are very challenging, some of these steps, but I also know they're going to take us in the right directions. It's particularly frustrating for all of us in the middle of a holiday season as we celebrate Hanukkah, Kwanzaa, and Christmas. But as I said earlier, all must do our part here in the city of Worcester. We all come together as a city, and we've been doing that over the last 10 months. That means continuous sacrifices now, so that this time next year, we can sit around with our table with our loved ones and we celebrate the holidays next year, which is so important. So we have several more weeks, Doc, I would say. If we can stay out there, work together, we will get through this as the city of Worcester, as we've done so many other type of challenges that we've had in the past. This year, as the governor said this week, we are asking folks to take seriously the spike we saw from Thanksgiving and the burden that has a place on our hospitals. If we do that again coming out of Christmas, we risk further overwhelming our already strained hospital systems and the dedicated frontline workers. And you can find tips on how to safely celebrate the holidays this year at www.worcesterma.gov or again at www.mass.gov. That's so important. I think Dr. Hirsch talked about this over the last couple of weeks, that our healthcare workers are tired and that they could use our help by really trying to comply with the face masks, social distancing, how many people you gather with. So it's very important. In closing, I just want to acknowledge once more, I know we've all been living our lives so much differently, and it's particularly difficult during the holidays when you are used to gathering with loved ones. This year we ask you to reimagine Christmas. If you want to get outside and spread some Christmas cheer, I encourage folks to visit the City Common and take in the amazing lights and displays right outside City Hall. It's absolutely beautiful if you want to come around City Hall and take a look at night. I want to give big thanks to our partners who made this happen: Creative Hub of Worcester, Main Idea, Main South CDC, Technocopia, and Tower Hill Botanical Gardens, and also a personal thank to Luna Sol for geometric shapes on the common. And again, I just want to thank everyone who's helping here. I want to thank our city workers, our public health department, who again are tired, who have been working 24/7 since March. I want to thank all the workers at UMass and St. Vincent's and all the healthcare workers in the nursing homes and all the different medical facilities. I want to thank our first responders, police, fire, EMS. We're working as a good team here in the city of Worcester. And again, working together, we will get through this. We have several more weeks, but I know we will get through this together as a team. With that, I'd like to turn it over to Dr. Hirsch.
Thanks, Mr. Mayor. And yeah, it's going to be a rough couple of months coming up just because the vaccination program is kicked off, but it's going a little more slowly than I think people, at least in this current administration, had forecast. At UMass, they were able to administer 2,300 vaccinations in 10 days, which I think is pretty amazing. And there's 1,100 scheduled for next week. And we just got a load of another 2,500 doses of Moderna vaccine at the hospital. And we still have probably another 1,000 of COVID Pfizer vaccination left over even after all those scheduled appointments. So I think we're going to at least go through the medical system at UMass, and I'm told from Dr. George Abraham at St. Vincent's things are going very, very well there. But what you heard today from the mayor, the statistics showing that 100 healthcare workers a week are going down with COVID. This is a real stress on the system, as we've been talking about. Every time one of those workers goes down, schedules have to change, shifts have to be adjusted, whole units sometimes have to be put on quarantine because of close contact, and it's a real dent in our system because we don't have the reserves to call upon. So it stretches us even thinner. Despite all that, I went down to the injection center just to see what the vibe was there, and I will honestly tell you, I only watched about 10 people getting vaccinated, and I would say 6 of them had tears in their eyes as they were getting it. The sense of relief and the sense of accomplishment that we made it to this point was really palpable. And the pride, I think, that we have in Worcester that we were a big participant in the Pfizer trials is a really big deal. Moderna is also going to be using us as a trial site to test its vaccine on younger patients, so 12 to 18-year-olds. The Pfizer vaccine is approved for 16 and above. The Moderna one, 18 and above, but there will be trials to see if we can vaccinate the essentially teenagers, because we know that from the stats, they probably have the same transmissibility as adults do. It's when you hit around 13 that we start to see a difference in transmissibility. The littler ones don't transmit quite as much. So I did my kind of call check-ins this week with the various community health centers and both the medical centers, and the number of ICU patients continues to rise, but I think because of the knowledge we gained from the spring, the number of ventilators that we have to use is less. That's great. The death numbers are slowly creeping up, as they always lag behind the numbers of people that are admitted, and we're going to see more of that, I think, in January. As the mayor referenced, all the models that are being espoused by both St. Vincent's and UMass think that we're going to see the biggest spike again sometime in that week of January 11th. That supposedly, if our plans are approved for vaccination distribution, is when the state might deliver for the city its allotment of Moderna vaccine. And the Emergency Operations Center, the Emergency Preparedness Division of the Department of Public Health, and all of Karen Clark's crew, all of Megan Gomes and Mike Shanley's crew have been working nonstop to put together a model and a location or locations for mass distribution of this, so we can at least start by covering our police and fire workers and some of the ambulance services that are not involved with the Worcester EMS system, because UMass has graciously agreed to vaccinate those folks. So those plans are being worked on as we speak. None of it is going to stop over Christmas. They're still getting generated. I'm getting 5 or 6 emails and 5 or 6 meetings scheduled. It seems like every time I go back on my phone, that's what I find. And I'm very grateful for that, because as Dr. Morse, who held the office as Commissioner of Public Health for over 30 years for the city, always said public health never sleeps, and that's how our crew has been working. I'm optimistic that we can get everyone in that really frontline COVID-facing group to be vaccinated pretty quickly, and that by the end of January, I'm hoping we would have everyone vaccinated, and we could move on to that phase 2, which, as we talked about last week, phase 2 is supposed to be essential workers. It's supposed to be people in the communities of color because they have demonstrated more vulnerability to the virus. It's also supposed to be people over the age of 65 with one or more comorbidity, or people over the age of 60 with 2 comorbidities. And so we're going to have to do a lot of work to sort all of that out and to see where we can, get enough vaccination power. And part of that is going to be in a program that the Graduate School of Nursing and UMass Medical School are doing jointly with the Department of Public Health. We have a training session that will go on in early January before this vaccine allotment comes in to train this vaccinator army. So we hope, somewhere in the range of 400 to 500 vaccinators that we can use once we set up these locations. So I think it's just an illustration of what the mayor was saying. We have really shown the entire year how we pulled together, how we, as a city and as a medical community, as a city government, it's been all hands on deck. In many ways, the hierarchies have all been thrown out, and it's just basically everyone just saying, what can I do? What can I do? And I think that goes for the citizens. So many times, unfortunately, recently, people have been coming in with the COVID infection saying, I've done everything right. I've done everything right. I've done the 3 Ws. I haven't traveled. Why am I getting it? And I think this is just an example of how transmissible this disease has become. I don't think we're experiencing yet the London virus yet, or the South African virus, but we definitely know that the virus here has mutated in many of the samples that we're collecting. And transmissibility doesn't necessarily mean that the vaccine is not going to work, because the vaccine is working on that outer coat of the virus, the spike proteins, and in all of the studies preliminarily that have been done, the new mutations of the coronavirus have not changed that protein. So we're still optimistic that this vaccination that we're going through is going to work against these newer mutations. But it is an indication that we're not going to be able to rest easy, and that if the variations in the virus moving forward change enough, we may have to be in a situation where we get vaccinations on a regular basis. None of that is really clear yet, but I think the first step is at least get us the herd immunity that we need to get us through. And Dr. Fauci today alluded in a couple of appearances that he did that the original number that he was espousing of having about 65–70% of the community vaccinated in order to get this herd immunity might be a tad on the low end of what we need, that we might need actually more like 75 to 80%, which Governor Baker has been espousing. He's been saying he wants to have 80% vaccination. So whatever it is, I promise you the Department of Public Health and the medical community here is committed to getting that done, and we will get it done. And once we get it done, which will, I think, still take us about 6 months into 2021, I think life will start to look a lot more like we remember from before the pandemic. So the other thing I wanted to note was that the travel suggestions of trying to keep your family gatherings at a minimal, we are still seeing in the numbers. Today we had the second largest single day of reported COVID infections of any of the times since the pandemic started. We had the largest day was 2 weeks ago. This this total, it was like 260 cases, is an indication that I think people are worried about the travel that they did in Thanksgiving and the anticipation of maybe being able to travel in Christmas week. And it's just not a great idea right now. Our positivity rate in all the testing centers is still around 27%, so it's about 1 out of 4 people that come in to get tested have been testing positive, and those odds aren't great, especially with how transmissible we're finding the virus to be now. So the 3 W's, you've got to stick to them. Keeping your bubble intact and impenetrable, that's a really key part of all of this. And I think you could still have fun this Christmas and next week for New Year's by maintaining some of the traditions virtually, using the phone, using your computer, watching your favorites on TV. Tonight is the 24th consecutive airing on WNBC of It's a Wonderful Life, which is my favorite movie, period. It's a classic. It was post-war. It was released in 1946. And what it tried to show is that every human being has an impact and every human being has a worth. It's not measured by monetary things. The guardian angel in that movie, Clarence, convinces Jimmy Stewart that he should go on living even though he's having these terrible personal travails because he has so many friends. And he says in a little note at the end that you might remember from watching these over the years, no man is a failure who has friends. I think that's how Worcester has been rolling. We are a success in fighting the pandemic because we look out for one another and we make sure that nobody is left behind. So I'm very grateful for having been able to spend at least the last 9 months trying to do my part. And I hope that all of you have a wonderful holiday, and thank you again for helping us get the messaging out and getting it right. It really has made a difference. The last thing I'm going to say is happy 80th birthday to Dr. Fauci, who is my hero, and I think all of us will look back in history as he being one of the greatest medical heroes we've ever had in this country. Thanks.
Any questions?
For Dr. Hirsch, you mentioned expect another surge in maybe middle second week of January. When we've had surges in the past, it's been maybe in November when the numbers had come down and they're up. What does that surge kind of mean for the healthcare facilities for Worcester when our numbers are already so high?
Well, I think it's a signal to us, and we're preparing for this to gear up in the DCU center. Because we're going to have more surge capacity than just 50 beds, which is what they're going to be elevated to capacity by Sunday. They said they'll be able to take care of 50 patients instead of the 30 that they have now. I think that when the virus load in the community is that high, that's when we will start to see patients just overwhelmed with such a big dose of this that they will have these really bad admissions with requirements for the ICU. And unfortunately, the ICU is utilization is always a precursor for seeing increased mortality numbers. It's great that in this first stage of vaccination, we're going to go hard on the long-term care facilities with the help of the Walgreens and the CVS's of the world. Because I think that will help us avoid the Holyoke Old Soldiers Home kind of experience that we saw in the spring. But I think that these invincible folk, the 20 to 50-year-olds that have been thinking maybe virus is like not much more than a flu, they're in for a surprise if they get it. And you don't have to look much farther than some of the people in our city office that have had it and are really, struggling as they get back. So I really want to see us get the herd immunity the right way with the vaccination and not by getting the virus. And, we've seen postings like the city mayor just alluded to on Facebook of invitations of people to big Christmas parties in their homes and New Year's events and things like that. Just not sensible. Not if the people that are in those postings are going to be coming from outside of your bubble. Merging a whole bunch of bubbles together is not advisable right now.